So let's make a start. Carers Support Centre Chief Executive Officer Tim Paul will introduce today's events.
Well, good morning, everyone. As Caroline said, I'm Tim Paul. I'm the Chief Executive here at the Carers Support Centre, and it's my privilege this morning to welcome you to this Carers Rights Day event. I would like to say it's lovely to see so many of you here. Unfortunately, I can't, not because there aren't many of you here. I can see from the list, which is going up all the time, that there are quite a few of you here. But having to use this webinar technology means that we can't see anyone, whereas you can all see us, which is a little bit disconcerting. So please bear with us as we go through the morning. Looking at the agenda, we've deliberately tried to focus on one or two key issues that carers have told us are really important to them, rather than try and cover a whole host of carers' rights issues. And hopefully through doing that, we can do justice to a few topics and debate them properly, rather than tackle lots of things not quite so well. It's really difficult at the moment not to mention the pandemic, although I did say to myself I'd try and get through this without doing it. But there was a recent survey of around 6,000 carers, and it came up with some probably unsurprising outcomes. But more than 4 out of 5 carers are providing more care for relatives now than they did before the pandemic. Over 78% of people have reported that the needs of the person that they care for have increased during the pandemic and are continuing to do so as it goes on and on. And over 2/3 are really worried about how they'll cope through further lockdowns and local restrictions, getting access to services, hospitals, etc. So to be honest, now more than ever, carers need to know their rights wherever they are in that caring journey, whether they're in the workplace, healthcare setting, when interacting with professionals, or at home. So today's a really important day for carers. It's one where obviously there's national recognition for everything that carers do and the challenges that they face. And whilst I welcome anything that increases the public awareness of carers and caring, anything that shines a light on caring has to be a good thing. One day alone really is not enough. And after all the noise and support of today's died down nationally, our challenge is to ensure that carers and the challenges they face, the support they provide, and their contribution to society remain very high in the consciousness of decision makers and policy makers and service planners and the public at large. So it's not just on Carers Rights Day, but really throughout the other 364 days of the year. I'd love to get to a stage where we actually don't need a Carers Rights Day, because it's part and parcel of everything that goes on every day. And as we sit here this morning, it's just worth reminding ourselves that across Bristol and South Gloucestershire alone, there are some 68,000 people who identified themselves as carers at the last census, and that's some 9 years ago. So undoubtedly, those numbers would have risen. And over 15,000 of those were spending 50 hours or more a week caring for someone. So it really is an issue that we do have to take seriously and look to provide more support for people. These are numbers, and they're important. Numbers are always important, but more importantly for me was never forget that we're actually talking about people, and sort of people, many of whom have physical and mental health issues of their own as a direct result of their caring role. Many have given up or reduced their paid work to take on a caring responsibility. And many report that they become very socially isolated as the toll of their caring role increases and they spend less time with friends and social circles. And as we all know, that many carers suffer financial hardship, with a number facing poverty. And at the end of the day, with probably 3 out of 5 people at some point in their life are going to experience caring, whether that's for a short period or for the long term, it's really important that we do our best as organisations to support carers in every way that we can, and really to ensure that every day is a Carers Rights Day, not just one day a year. So I'd like to thank you all for coming today. It's great to see, as I said, so many of you here. We really do appreciate it, especially with everything else that's going on at the moment. I'm sure you'll have an informative morning. And with that, I'll hand back to Caroline to get us on the way. Caroline.
Thank you, Tim. So with us today, we're lucky to have an excellent panel, including Tony Watkin, Patient and Public Involvement Lead at Universities Hospital Bristol and Weston. So Tony's going to speak first about the hospital charter for carers across both of the local hospital trusts. This will be followed by Judy Gowanlock, Tracy Lathrope and Sam Radford from Carer Support Centre Hospital Liaison Team, who will outline the rights for carers in hospital settings and the support that Carer Support Centre can provide to carers when the person you care for is in hospital or being discharged. This will be followed by Eleanor Warrington, who's the Quality Improvement Lead at Serona, who's going to update us on community health services across Bristol and South Gloucestershire. And we're also being joined by Sharon Womer, who's the Inclusion Coordinator, and Glenn Townsend, Patient Public Involvement Lead at BNSSG CCG, and that stands for Bristol, North Somerset, South Gloucestershire Clinical Commissioning Group. And they're going to respond to any additional questions around the funding of community health, hospitals or primary health care. So without any further ado, I'd like to welcome Tony Watkin.
That's great, thank you very much indeed. Can you hear me well enough? So I think I'm going to talk a little bit about the charter and what it means to the trust, but I want to start off by putting a bit of context to that, because I'm myself, I have caring responsibilities for my son, who's 20 now, and he has autism and a range of other issues. So this work and the work that I support in the trust in relation to carers is close to my heart and so important. And from the trust's point of view, this is a relaunch of a commitment that we've made to carers. And it's both University Hospitals Bristol and Weston and North Bristol Trust restating our commitment to promoting a culture of supporting and working in partnership with people that have caring responsibilities in our hospitals. And never more important than at the moment, because as you'll know, we have restricted visiting hours in the trust at the moment, and we worked hard to make sure that if you have caring responsibilities, you are still able to come in and support your loved ones. And that's really important, because from our point of view, from our trust's point of view, carers are absolutely partners in care, and it's really important that we respect that, we listen to what carers tell us, and we understand carers' needs. And I think we do a lot of good stuff. We don't always get it right, and we work hard with Judy and the team to really try and make sure that at every opportunity we're learning from our relationship with carers and we're improving what we do. So suffice to say, I'm delighted that we are relaunching this. I'm delighted that we're relaunching it on Carers' Rights Day. And if you are a carer coming into our trust and to North Bristol Trust, I really hope that the care and respect that you receive from us reflects what this charter says. And if it does, tell us. And if it doesn't, tell us. Because by working together, we can just continue to make things better for everybody. So thanks ever so much. And I'm going to hand back to Carolyn.
Thank you, Tony. It's really wonderful to hear about that, and it's fantastic timing around Carers' Rights Day as well. So I'm going to hand over to Judy Gowanlock, who's going to launch the next presentation.
Hi, welcome everybody. It's nice to be here, and as Tim said, it's nice to know there are a lot of you here, even if I can't see you. I hope you can see my slides okay. So I'm going to talk a bit about what we do to support carers in hospital, and I'm also going to be joined by Tracy and Sam, my colleagues. And now I can't get my slides to move. Let me just try this. Here we are. So I'm going to talk a little bit about who we are, where we work, how we can help you, a bit about what you can expect in hospitals at the moment, because I believe really strongly that if you know what's coming, it's much easier to cope. And we'll talk about some new developments in the hospitals as well. So I always like presentations with some photographs. So here are photographs of us all. I always think these photos are quite funny because everybody else looks very glamorous, and there's me in my garden, which is looking very overgrown. But just to give you a picture of us all, the four of us. So we work at the BRI, the Oncology Centre, the Heart Institute, the Eye Hospital, South Bristol Community Hospital and Southmead. We don't do a lot of work at outpatients at the moment. We're a small team, we're all part-time. We do what we can in outpatients, I would say. We're not funded to work in inpatient mental health services. And as regards the Children's Hospital, we're not doing a lot of work there at the moment, but that might change in the future. That's an area that we're thinking of developing. So what can we do to help you? I think the most important thing that we do is listen to you and treat you with dignity and compassion. I think any hospital admission is difficult for carers. I remember, my dad was in and out of hospital, my mum was in and out of hospital, and I remember feeling totally overwhelmed and really, really stressed. So having somebody who you can contact, who listens and understands, I think makes a really big difference. We can explain hospital processes so you know what happens next. We can do a lot of liaising between you and hospital staff. We can attend online meetings. We can give you advice and provide you with information. And we can link you in with other sources of support. My role is more behind the scenes. So as Tony said, we work very closely with both trusts and we attend quite a lot of meetings, and we really want to put across carers' voices at those meetings. I do quite a lot of training of staff. So last week I was training advanced nurses about carers, and I think hopefully I opened their eyes to a few things that they just hadn't thought about before. We also get involved in organising events to raise carers' profile. So it feels like a few weeks ago, but possibly it was more, I think it was October, wasn't it? We had Health Matters, which was a big event at UHBW. And one thing I want to develop, but that's a bit on hold at the moment, is I want to develop an accreditation scheme for hospitals showing how carer friendly they are. And that would result in hospitals getting different awards, but I really want to involve carers in that. So that's something for the future that hopefully I can get you involved in. Just to say a few things about what people say about us, and these are a range of different comments. I'm really proud to work in this team. I've got amazing colleagues who go an extra mile to support carers. And I think just the range of comments that we get, both from other organisations that we work with, from carers themselves, and from staff within the hospital, shows how valued we are as a team. So I'll just pass over to Tracy now.
So I hope you can all hear me. So this next slide is the Carers Charter, which obviously Tony has already discussed. And this is to recognise the important role that carers play in the hospitals. And that's been signed by both trusts. So I won't go too much into detail about that one. So we've made a couple of slides of the things you need to know about visiting. So at the moment in NBT, they're not currently allowing visitors, but there are exceptions. So exceptions can be made under compassionate grounds for carers if the patient has specific needs that require the support of the carer. And the UHBW is very similar. The exceptions can be made under compassionate grounds or if the patient has specific needs that require the support of the carer, including vulnerable patients, patients with dementia, patients with learning disability, or with a key carer. So what we advise is that you speak to the sister on the ward to see what the situation is, because it is ever sort of changing. So what we recommend you do is, before you leave home, if you're going to visit the hospital, is to speak to the ward before you leave, and also perhaps check on the websites to see what the situation is. So things you need to know around the discharge arrangements. So if the person you care for needs to go into, needs to have a social work assessment, that's currently now being done in nursing homes. So patients will be discharged to a nursing home temporarily for a 6-week period, for up to a 6-week period, and the social worker will assess the patient there. Unfortunately, there won't be a choice on which nursing home patients are discharged to, so it depends on spaces and the needs of the patient, but it is just temporary. Just to note that the visiting arrangements in the nursing homes are limited, and there is usually an isolation period of 14 days when the patient first goes into the nursing home. So that's around discharge. With regards to technology, so wards across both trusts have iPads and walkie-talkie phones, so carers can keep in touch with the person they care for. There is limited availability sometimes with Wi-Fi on certain wards at the hospitals. So again, check with the ward to see what they're offering with regards to keeping in touch with the person you care for. And UHBW have just launched the Message to My Loved One service. So this is a new service to help families and friends keep in touch with their loved ones. It allows people to send messages via email or dedicated phone line, which will then be printed and delivered to patients. So messages can be received by 11 o'clock each day, Monday to Friday, and will be delivered to patients in the hospitals. And you can also drop off gifts, letters and essential personal items Monday to Friday on a morning, and those will be delivered to the people that you care for. So that's something new that's just been launched.
So at MBT, they've recently introduced carers cards to identify carers on the ward. Once it's been agreed with you that you can visit to provide care for somebody in Southmead, you'll be given a card which you can show when you arrive at the hospital. Again, also at MBT, they're doing virtual visits using iPads, and there's a procedure involved in organising those. And the move makers, who are the volunteers at MBT, I believe they can take small items of personal belongings to patients on the ward. I'm sure there's a lot more Sam could say about this, so I do apologise for stepping in. Just to say where we work and give our contact details. So Tracy, who you've just heard from, works primarily at the BRI, but Angela, who's not here today, also is involved and will support carers at the BRI. And so their contact details are on the slide. South Bristol Community Hospital is primarily where Angela works. So we're all working remotely at the moment, but that's a hospital that she tends to cover. And Tracy will also help out with referrals there. And Sam's main place of work is at Southmead Hospital, and we all work part-time. So on the days when Sam isn't working, Tracy and Angela can pick up referrals. So if you forget our details, don't worry. Just say to hospital staff, I know there's a carers team that supports carers in this hospital. Ask them to refer you to us, or think about ringing carers line. So the key message that we really want to get across to you is that we're here, and we're here to support you when the person you look after goes into hospital, or if you're in hospital yourself and you need some support. So thank you very much, and if you've got any questions, please feel free to ask us. So I'll just stop the screen share.
Thank you all of you for that, and I'm really sorry, Sam, about us not being able to hear you. So we've actually got a question that's come through. At a recent hospital-related webinar, I think it was probably in October, it's proudly stated that UHBW, University Hospitals Bristol and Western, carers are no longer classed as visitors. So can you have a carer and a visitor? Is this no longer the case with regards to carers? So I suppose the question is, can there be a carer and a visitor? I don't know whether Tony or Tracy might be able to.
As far as I'm aware, yes, you can. There is a carer. I'm sure Tony can confirm that. If you can hear me.
Can you hear me?
Yeah.
Yeah, great. Okay. So the situation is that when visiting is allowed, you know, you'd have one visitor, but a carer wouldn't count towards that one visitor. So you can be a carer and have a visitor. At the moment, visiting is restricted. So it would be on exceptional circumstances, rather like Judy outlined earlier. But just to restate that if you have primary caring responsibilities, then you wouldn't be counted as a visitor. That makes sense.
Thank you. Yeah, that's. I think that's answered the question. If that carer wants any further clarification, feel free to type into the Q&A. Thanks for that. Got another question. What happens if the carer is taken ill, for example, with COVID? What then happens to the care of the person that they're caring for? I don't know if anyone would like to answer that. And that's a question around sort of carers emergency cards, isn't it? So we could send you some information about carers emergency cards and ask our coordinator Lisa. She'll be able to provide a bit more information for you, unless anyone else has got anything to add.
I think so. Hi, I'm Eleanor from Serona. We're in the case of say if a carer goes into hospital as an emergency, then that's when you utilise the local authority and social services. Otherwise, if you're able to manage them, yes, it would be a carer's card, or it would be utilising family support. That's my understanding.
Yeah, thank you. And it is worth all carers getting a carer's emergency card in case something like that comes up. And there's information about that on the last webinar that we did in September. So you can see a video of Lisa talking about that on the carers website, Carers Support Centre website. But there's also a page about carers emergency cards up there. And with the notes to this webinar, we'll send out further information about how to get a carer's emergency card. Thanks for that question. We've also had a couple of others as well. So does Southmead have a message to My Loved One scheme as well? No, so that's not the case. And you mentioned events, Judy. Are there any events coming up?
Not at the moment. Obviously, the hospitals are under considerable pressure at the moment. So we haven't got any events coming up, but we are looking in December. We're as a team, we've got a planning meeting, so looking at things that we can do for next year. We did trial having an online carers cafe during the last few months for carers, but who had somebody in the hospital, but there wasn't a lot of take up for that. It might be things are different with that now that people have got more used to Zoom. So it's certainly something we will review. And yeah, I mean, if there are any events that we can do to raise the profile of carers whilst working remotely, we will do them. And we were really pleased that that Health Matters event went across. It was a big event for us, and I think did a lot to raise the profile of carers in the trust.
Thank you. And do all staff at the hospitals have to attend training on carers?
Okay, so at the moment, well, before lockdown, we used to deliver, Sam and I delivered a lot of face-to-face training at MBT, and we had a training slot on the induction, and also for staff, they attended like a 3-yearly update. That training is going to go online. So I've been liaising with somebody at MBT who has much more technical skills than me and is going to put it into an online version. But I also deliver sort of team teachers, so I do like individual sessions with different teams. At UHBW, I train nurses who are new to coming to the trust. Again, that's done online. I'm hoping to do some training of the pharmacy team. I'm also training, as I said, advanced nurses at UE. So wherever there's an opportunity for training about carers within the hospital, I will do it, you know, as long as I've got capacity, because, you know, we're really passionate that staff need to know about carers and need to understand the issues and the complexity of issues that carers face.
Okay, thank you. Are there any further questions? If so, quickly pop them into the Q&A box or raise your hand. And if not, we'll move on. Okay, so I think we'll move on then. So we're lucky to have Eleanor Warrington here from Sirona Care and Health, who's going to give an update on community health services. Actually, I should have also said thank you very much to the hospital team for that really informative presentation, and I think there's certainly been some interesting questions around that as well. So thank you. So welcome, Eleanor, and thanks for joining us to talk about Sirona.
No problem. Hello, everybody. Thank you for inviting me. So yeah, my name's Eleanor Warrington. I'm the Quality Improvement Lead for Sirona Care and Health, and I've been asked to come along and give you all just like a quick update of what's been going on with us. So I thought I'd just start by saying who we actually are. It's easy to assume that everyone knows who we are because I work for them, but Sirona Care and Health are the community interest company responsible for community services within Bristol, North Somerset and South Gloucestershire. So for community services, what I mean by that is your district nursing teams, your specialist services teams, musculoskeletal teams, learning disabilities, that sort of thing. So we're responsible for that care in the community. So what's happened recently with Sirona is originally we were part of the Bristol, North Somerset and South Gloucestershire, or the BNSSG wide organisation, and Sirona were originally just in charge of the South Gloucestershire arm of it. Recently we were awarded the contract to take on Bristol as well as North Somerset, so that means we took on the contract from Bristol Community Health, who were responsible for community services in Bristol, and North Somerset Community Partnership, who were responsible for the community services in North Somerset. So we went live with that contract in April as COVID hit. So it's been quite a fun time for Sirona. But fundamentally what has changed now is that the services that you receive in the community within BNSSG will be the same. So if, for example, you or the person that you provide care for fall ill or require community services in North Somerset, the care that you receive will be the same as the care as if you were living in Bristol, which is so it's all quite exciting and very interesting time to be part of the community services. Within that, we are also developing different ways of working. So that has brought about these new different hubs, if you like. So if you see, I put what's new, I put INT, specialist services and locality working. Now, INT is the integrated network teams, and that's your district nursing, your reablement services, if you like. Specialist services are things to do with intravenous therapy and musculoskeletal problems, okay? And then within that, we're all working in a locality. So the idea is that we're bringing the care that you receive closer to your home, okay? So that's been the biggest change, and we're still going through a big process around that. Like I said, COVID has obviously struck, and we've had that challenge as well. Although hopefully on the ground level, what we're hearing is that people haven't found it too disruptive. You know, we've been trying very much to do not only business as usual, but also to make sure that we are providing safe care in line with the guidance that we've been given. So that's around, you know, PPE and looking at ways that we're using technology in practice. One thing you may find different is that we're asking people to think about how they use their services. So for example, if you ring up your GP and say, you know, I've got a cough or I'm acutely unwell, if you think or you would prefer to see a GP, it's helpful to have that clarity to help community services. What we want to do is limit people going in if it's not the right service. So it's all about getting the right service to the right person. The other thing that we're asking people to consider is if they've got, say, a service coming in like a district nurse, I don't know, to have bloods taken. If there's a wound or something, is there something that we could do, you know, 2 visits in one? Okay, we're just trying to limit, you know, what we're doing, that sort of thing. Okay, so those are the main things that have changed. And then, so the directorate that I work in, so that's quality improvement, within that sits engagement and customer care, which is where we really want you guys to come on board with us. One of the benefits, if you like, of it sitting within the quality directorate is actually the vast majority of us are clinicians or have been in our past lives. So my background is nursing, and I've been a nurse for nearly 20 years, and I've been with Sirona for 13 of those. So we're all quite experienced clinicians, and now I think that helps when we're asking people to engage with our services. One of the things we're working on at the moment is bringing about workshops for carers and service users to come and work with us to help us to shape the services that they're receiving. We're going to be developing surveys, and you'll be starting to see friends and family cards testing coming back out to you guys again, which is just like a 5-minute paper card where we're asking you how you found the Sirona service today. And by engaging with us in that way, what we're asking and what we're hoping is that patients and their carers get on board with helping us shape the community services. That's what's so exciting about it at the moment, is it's new and you guys do actually have a voice. So you can see here where I've put how you can contact us. That's our telephone number. This is how you would get involved in the quality, how you get to the quality team. Okay, so there's the customer care and the engagement service there. Okay, and the Have Your Say button is on the internet version of Sirona. Okay, so you can just click in and tell us, let us know what's working, what's not working, what would you like to see, what do you think's not, you know, we don't need, you know, that sort of thing. That's what we're asking people to engage with us about. The other element that we've got going on with in terms of engagement is the People's Council, and this is something that's actually quite exciting. This is a group of people or service users, carers, those sorts of things that have created their own group, if you like, and they get together and they help inform Sirona services. And then someone from that People's Council will end up being co-opted to the Sirona board. Okay, so that you'll have the executive directors, but you'll also have a carer or service user on that board. So you've got a real voice and a real chance to help shape these community services that we're getting. The other thing that we ask, and you may get approached by whoever you've got involved in your care, is we have service users actually coming to board to talk to the board members about the care that they've received from Sirona. So that can be good things, things that have done really well, or things that maybe we need to improve on. And what that does is it provides us with a real lived experience of what people are having on the ground level. I mean, it's all very well and good us developing these wonderful services, but we want to know if it's working, and we want to know where we can improve. So if something good happens, please tell us, because we can feed that back to the staff involved, and that's great. But also, if there's something that you think we need to change or develop, please let us know as well. And that's basically all I really needed to talk to you about today. That's all the information there and how to get hold of us. And yeah, welcome any questions, or, you know, if you can't think of anything now, you've got our email, you know, back to you, I guess.
Thank you. It's really good to know that people can have a say, and that's so important for carers. A carer's voice is so important, especially around health services and community health services. We have had a question. Do you provide services for children in Bristol?
Yes.
Yeah. Okay.
We don't, not to, yeah, yes.
Yeah. Okay, thank you. And we do have had a question ahead, actually, which I think might be more one for Glenn to answer from the CCG's point of view. So discharge nurses and rapid response teams are overwhelmed as a result of COVID-19. Are there measures being implemented to support them? So will there be any additional funding for those teams?
I think that's a question for me. Okay. Because we do district nursing services. So yes, it has been a very busy and very, very challenging time, and our staff have been absolutely awesome, I have to say. There have been things that we have put in place regarding extra support services. So we've been providing daily updates. So I was a nurse on the front line when it all first started, and actually what happened was it did get quite confusing. I don't know if you can remember when it all happened. I think we had about 5, you know, some days you'd have a policy change 5 or 6 times, and it can be quite overwhelming. So hopefully that has calmed down a bit. We've done things like we've rewarded our staff half a day free time off, if you like, and they're to use that time to do something that they would like to do. So it's about giving them a bit of time back, just to not use it as annual leave, not use it as you know, dropping your kids off to the dentist, but use it for them, you know, for their well-being, if you like. So we're doing regular updates. We've been giving them some extra time off. And then it's about, so part of the thing with the locality working is it's bringing the care closer to the home, but actually it's bringing the staff closer together. So what we're finding is that people aren't working in so much of a silo. Granted, they're working sort of differently, if you like, with social distancing, but there's an easier way for them to keep in touch with each other. And there's, because these pools are smaller, there's more managers around, I guess, but for smaller amount of people. So it means that they can feed up. So that's how we're doing it.
Great, thanks for explaining that. That's really helpful to get that background as well. So that's answered that question really well. We have had another question, but I think it's probably beyond the remit of today's panel, but I'll just read it out in case anyone does want to make any comments. And if we can't answer this today, we will speak to our partners at Rethink Carer Support Service, so I think might have a helpful response, and we'll send that out by email. But in a mental health inpatient case, the patient has withheld permission for doctors to speak to me about him. If he eventually comes home so that I become his carer again, what is my position about this? So that's a question around rights for mental health carers.
Caroline, it's Glenn from the CCG. Yeah, I'm sorry, it's work in mental health commissioning. I think for that one, you do have rights still as a carer, and I would advise contacting Rethink in Bristol, because they provide carer support, but also Bristol Mind provide advocacy support for inpatient services, and that includes carers as well. So they will be able to help around the specific legal aspects of that, because obviously it's distressing, I know, when you're in that position, but there are still options to discuss, and I'd advise contacting Bristol Mind Advocacy Service and Rethink. I think Caroline will be able to probably send you there you go, you put it up already. And Bristol Mind Advocacy is open to carers as well, so you can contact them for advice around the legal position and stuff like that.
Thanks, Glenn. That's really helpful, and we'll also circulate the Bristol Mind links just gone on there, and we'll circulate that with the notes that go out. Any further questions before we move on? Let's see if there's any raised hands. think that's it for questions at the moment. So we'll move on then. So we're actually sort of drawing to an end of the event. So I just want to say thanks so much for taking the time to join us at this morning's webinar, for all of your questions and your input. And I've certainly learned a lot from all of the panellists and presentations, and it's been great to have such a wonderful panel here today. I want to say thanks to you as carers, thanks to panellists, but also thanks to Dennis, who's been in the background sorting out the technology, and we will circulate dates for 2021 open meetings in due course. Now we've got some closing comments. I wanted to let you know that there's a carer called Karina who's going to be on the John Darville show today from 12 to 12:30. That's on BBC Bristol Radio. She's going to be talking about her experiences of caring, so do have a listen if you can. She's very articulate. She's a relatively young carer in her 20s. She'll be really interesting and inspiring to listen to. Spaces are still available for our afternoon workshops, so I'm going to just post some information here in our chat about that in a moment. So the afternoon workshops include healthy eating. They also include lasting power of attorney. There's also move and meditate and carers allowance. So if I can see if I can get that into chat. Here we go. And I've also popped into chat some information about a couple of events that we've got next week. So on Monday, the 30th of November next week from 11 to 12, there's a session on plant-based cooking. So that's being held on Zoom. Just sounds really interactive and fun. So if you are able to make that, you might enjoy it. That's from 11 to 12. Another relaxing session for carers is chair yoga on Tuesday, and that's at 10 o'clock, 10 to 10:30 on Zoom. That's the 1st of December. And we also have online carer support groups that some of you might be interested in attending. That's a chance to chat with other carers and provide each other peer support. I also want to say that whether we like it or not, many services now in general, not just carer services, but general services are now only available online. And we're really aware that many carers find it quite difficult to use online services. So we are doing some work around thinking about how this can be made more accessible for carers. If you've got any ideas about how this could be made easier for carers, please let us know. You can email me, Caroline M, at carersupportcentre.org.uk, or respond to the email that you got about this webinar, and we can take those views into account. I'd also like to say that it would be worth having a look at our website. We've launched a series of films this week for Carers' Rights Day. So that includes a film from the hospital team, again, just to talk about their services. It includes information about employment for carers, how to become a carers rep, end-of-life care for people caring of people with cancer. And there's also a massage and meditation video up there as well. So do have a look. I've just posted that link in the chat. So without any further ado, I don't know if anyone had any further questions that you'd like to ask now. Oh, yes, Julie's just announced that there's a Twitter account for the hospital team, so do follow the hospital team's Twitter account. Carer Support Centre's launched a short film, and it's about Carer Support Centre services. So we're going to end with that now. Do feel free to keep chatting as that's going on, and then the meeting's going to finish. So I'd like to just say again, thanks very much, everyone, and we look forward to seeing you at the next webinar.
A carer gives support to someone who could not manage without their help. They could be caring for a relative, partner, or friend who is ill, frail, disabled, or has mental health or substance misuse problems. All the care they give is unpaid. Anybody from any background and of any age can be a carer. Caring can include practical tasks, like housework and liaising with services. It can include personal care, such as help with dressing and giving medication. It can include emotional support and companionship. Taking on a caring role can mean facing a life of poverty, isolation and ill health. Many carers struggle alone for years, unaware that help is available. Carer Support Centre is here to help. Our services include practical information and advice, carer's emergency card, one-to-one support, liaison with professionals, including hospital discharge, carers groups, counselling and befriending, and training courses. If you care, we care. Contact us on Carers Line at 0117 965 2200 or visit our website at www.carersupportcentre.org.uk.